Well, part two with David Ashford and asking questions from the public. I must say that David has no knowledge of the questions, and I read them off as best I can. Without my glasses on, I know I'm being vain. Mr. Ashford, the first one, well, it's quite a difficult one. I'm concerned. I've been told my sample indicated high levels of midi-chlorinan, that's CHLORIAN. I'm not sure what that means, but I was wondering if you knew.
I'm not a clinician, unfortunately, Paul. I'm a politician. If people are concerned, I would suggest they contact their doctors. I'm not sure what sample the person would be referring to, but no, I'm not a qualified doctor, and so I haven't got the foggiest what that refers to, I'm afraid. But if someone's concerned about any form of test result that's come back, they should contact their GP in the first instance.
I probably said it terribly wrong anyway. Regarding the investigation into the origin of the recent infection of a crew member, this is about Steam Packet, why is no information forthcoming with the Steam Packet management, and why are they not attending briefings so they can be questioned by myself and others? They seem to be ignoring all requests for a representative to come forward and answer questions regarding the matter. This is a publicly owned company and is accountable to the Isle of Man people, not the government, and should be answerable to them. It's not for the government to be shielding the management from us. And finally, if the Steam Packet management are incapable of getting to the source of the major outbreak, then why hasn't our world-class track and trace team been deployed?
Well, in relation to track and trace on the Steam Packet has been done. Track and trace was done on those cases, but what it looks like is at some point there's an asymptomatic case. So we have to remember there will always be cases where we will never know the origin of it and where it came from, because you may have asymptomatic people in the chain. So you might have two people who pop up who might work at the same company, but they don't have contact with each other. And there may well be a third person who never had any symptoms, has by the time of testing, got over COVID-19 and so is never identified. And that will always be the case. We will never, even with the best track and trace in the world, identify the source of every single case. In terms of the management of the Steam Packet is a private company. The shareholder is government. But that operates exactly the same as any other private company. The management is responsible for the day-to-day running of the business, and basically they are answerable to the shareholder. The Steam Packet operates as a private company. If they wanted to go public with something, they can go public with something, but it's not something that we would make a decision on in that way. It's not like a statutory board like Manx Utilities or anything like that. It is still a private company.
They answer to the shareholder. The shareholder is you.
They do, but that doesn't mean that they go out in the same way as Manx Utilities to public press briefings and everything like that. They operate as a private company. If they wish to, they have their own press department, they have their own press publicity if they want to come out with it. We at briefings have given out information on what we've found so far, and as the Chief Minister has said, investigations are ongoing.
Back to staffing levels. Over 8, probably more nurses off work with COVID. Government are trying to get agency nurses over from the UK.
So we do use agency nurses. I'm not aware of us trying to bus large amounts of agency nurses into the island. We have medical practitioners who visit the island regularly from the UK, because as a small island health service, we are never going to be able to just have every specialist consultant or type of nurse around. We have resilience plans in place. We have bank staff we can call on who are actually island based. So agency nursing is actually very low level in terms of the staffing.
If you're told to isolate due to kids in the same household and they were advised to go home and isolate, including all household members, but if the kids have been living there for a few days and then moved to their other parents' property for the remainder of the isolation period, does that mean the other first household members can then end their isolation, or do they have to carry on?
Right. Well, if someone's in isolation, they shouldn't be moving. To be quite frank, once someone is instructed to isolate, they should stay exactly where they are for the period of isolation. So under the rules, you shouldn't have children that if they are instructed to isolate for 14 days and 3 tests, then they should not be moving properties. That is only for people who are not under isolation instruction, if I've read that question correctly.
How do the government think the various these supposed low-risk sites are only that sort of risk if they're there within the specified times. And it goes into a particular case, but they're saying that they can be in that location and they could pick it up maybe from a table, a chair, a wall, a counter, basically anywhere. The infected person may have coughed, sneezed, picked their nose and simply left the virus without being aware. Sorry about that.
Right. In relation to the virus surviving on surfaces, the science is still out on that. There's some reports that say that the virus can survive on surfaces for up to maybe 4 or 5 days. There's other studies that say that it can survive for a maximum of 72 hours. And there's even other studies that say it's a maximum of hours. So that's one of the areas of science where you can basically pick and choose a report that fits in with your criteria. We don't have evidence of the virus being able to survive long periods of time. So the further out a venue is from when we can trace back to the case occurred, the more low risk it is. So because people will have already developed symptoms. So for instance, if I can create a scenario, say there was an outbreak in a public house and it was traced back that was a week ago, most people who develop COVID-19 will develop symptoms within 4 to 5 days. So because the incident occurred a week ago, you would have expected the majority of people to have started showing symptoms by the time the case has been identified. So the venue itself becomes low risk at that point because those who may well have been involved will have already developed symptoms, or even if they are asymptomatic, be a good way through the infection.
I question this, I think, to the public health person at the time. You say that if someone sits in a pub nursing a drink by themselves in the corner and not doing much interaction, there's a low risk there. But my response was, surely at the end of the day, someone picks up that glass, takes it back, they may have gone to the toilet, anything like that. So it's this whole thing about what is a real low risk and what should just be in public concern and go for a test.
Yeah, it's assessed on the basis of the case. So, for instance, in that case, the likelihood of someone picking it up from a glass and so on is still exceptionally low. So the risk of transmission in that way still classes it as low, but we have to look at it on a case by case basis, and the way the person interacts, that's what defines it. But in low risk venues, we do put them out, or we did prior to the outbreak. It's not relevant anymore because we're locking everything down at the moment. But prior to that, we always put low risk venues out so people can be aware and they can be vigilant that if they do start to develop symptoms, or they feel or they start feeling unwell, then they can present for a test.
Can you also answer the question about taxi drivers again? Vaccinations sooner rather than later, please.
Yeah, again with taxi drivers, they will be done by age cohort. It doesn't particularly speed things up. Again with taxi drivers, it does not prevent you catching COVID-19. It does not prevent you potentially transmitting it to others as well. So a taxi driver that was found to have COVID even after vaccination would still need to isolate in the same way as they do now. Those taxi drivers that are most at risk are the older taxi drivers and those with underlying health conditions, and they are the people we are vaccinating at the moment. So people will be vaccinated not by their profession, but by their risk of serious illness from COVID-19, and that includes taxi drivers. So if you have a taxi driver that is over 50 or in the vulnerable category, then they will have their first dose of vaccine by mid-April, mid to end of April.
There are taxi drivers who take people for their tests. I think that's probably where the worry has been always expressed, hasn't it?
But again, like I say, that even if they are vaccinated, that would not stop them potentially contracting COVID-19 and also having to isolate.
But that it might reduce their risk. That. Sorry, but we have to add that in, don't we?
Well, hang on. But hang on. There isn't evidence. We need to be very careful here, right? Because the evidence around the vaccine is around reducing the risk of that person who's had the vaccine transmitting it to others. I haven't seen any science that actually firmly says that the vaccine reduces the risk of someone catching it. There is some low-level scientific evidence on that, but the transmission risk is on them transmitting to others.
Okay. Could you ask what the proportion of active cases are symptomatic and asymptomatic?
So in terms of the proportionality, obviously it's hard to say because a lot of the asymptomatic we will never actually pick up on. But of identified asymptomatic cases, it's around about a 60-40 split, I believe. But again, we need to be a bit careful on that because that's going back to the start of the outbreak. And like I say, we've got to be very, very careful around our testing capabilities, and the way we test has changed dramatically over the last 12 months. So we need to be a bit careful around that. The science reports I've seen have said that they expect around a third of people who will catch COVID to be asymptomatic.
This one's been asked many times, but I don't know if you've got any more to add. Why did you not go into a snap lockdown when the outbreak occurred on the 12th of February, like they had done in places like Perth, Australia?
Yeah, in relation to a snap lockdown, it wouldn't necessarily have achieved anything in that sense, because the seeding potentially was already out there.
Under Section 51 as amended, Mr Ashford could have closed venues on Saturday afternoon with no notice having to be given.
No, it's not. That's not quite correct. It's very specific, Section 51, and what it can be used for. The people are referring to the Public Health Act of 1990 and the powers within that to be able to shut places on a public health risk. But you've got to be able to prove that there is a public health risk at that venue to use Section 51. So it's not just a case of saying we assume there's a risk, so we can shut all your venues down. That would be open to legal challenge. We have to actually be able to use that particular section of the Act, be able to show there was an actual risk to public health from that venue, not just a suspicion of a risk.
Well, we'll be returning to that one, so I'll move on, because this place now they're talking about is a key working shop. I don't go into too much details, but they say these people work in a small office, cashing up. There's not enough room for social distancing, and this person spoke to the supervisor and said the company will have to carry on, but they do care about the staff. But this person's basically worried because they're in a very small, confined space.
Yeah, if it's an essential shop that can continue to operate, that does not remove the management and the company's responsibility to their staff to ensure that staff are working in a safe environment. It is recognised in some environments social distancing is impossible, and that's why there should be mitigation measures in place, such as PPE, etc., where possible. But it is down to the company to ensure they have risk assessments in place to ensure that their staff remain safe.
So we're back to the whistleblowers thing, or contacting somebody to highlight this issue, are we?
Yes. So if people have concerns, they can contact the Health and Safety Division in relation to that, the Health and Safety in the Workplace Division. But like I say, it is important and imperative that businesses do have risk assessments in place. Social distancing will not be possible in all circumstances, but there should be mitigation measures as far as possible in place around that.
Okay, ready for you to go now. I'm getting absolutely nowhere. FPS emailed that I should ring 682-262. Man at the end of the phone was at the end of his tether and says that they have nothing to do with the vaccine. So how do I get it? I saw you copied in on the email. It did actually have that number on it. So what's going on?
Yeah, so in relation to the vaccine, if like I say, it's driven by the primary care records of the individual. So if the person is within the age categories and they feel they've been missed, we are doing a reconciliation across all GP surgeries. I had an update on this yesterday, and I believe that reconciliation is now nearly finished. So additional letters to anyone who has been missed, for which I'll take the opportunity to apologise again for the problem that's been experienced in the 70 plus category. Those letters will go out early next week. And those people then will be prioritised against any vacant slots for vaccine.
This person says they'd like to know why all construction workers cannot work after today, when they sent this letter in, yet factory workers who are indoors with no ventilation are still allowed to go to work, and that's around 50 people, isn't it? Up to 50 people, something like that? Well,
again, in manufacturing, there should be social distancing where possible, and also PPE. In terms of construction, not all construction work has finished, because individuals are still able to operate if they're 1 or 2 man bands in an outdoor environment, assuming PPE is appropriately used and social distancing is in place. So there is certain exemptions for people who are operating solely or operating in vacant properties. So that work can continue.
Finally, with construction closing, but DIY stores able to do click and collect, would it not be the right thing for them to shut, as hundreds of orders are there, not essential, and people are just driving around to create more risk? Surely they should close and do their bit.
Right. In terms of DIY, they do remain open for the trades because there is emergencies that still go on, whether we've got a lockdown or not, people's plumbing going, various things that might pose a risk. In terms of domestic, they are not open to domestic customers other than for click and collect. Now, click and collect itself is actually deemed quite low risk. You haven't got people wandering around stores with the same interaction. The stores should be putting measures in place to make sure they don't build up queues of people trying to do click and collect, and it's managed in a safe way. But click and collect itself is actually deemed exceptionally low risk.
Right, well, that's the questions. I'm sure there's more coming in as we're speaking, but thank you for your time again. We'll be hopefully doing this again next weekend. Is that okay?
Yeah, definitely, Paul. I enjoy doing it with you, and we can keep it as a regular thing.
Absolutely. So send your questions in, preferably by email. news@manx.net is probably the best one. I do try and keep up with the Twitter feeds, which are going at quite a pace, and also on the Facebook things as well. We're on Sunday. You probably said, unlike at the moment, any press updates, but you expect next week, will it? I mean, I know it's a bit early, but do you think every day next week again, or as
I don't, unless we've got something to announce, I doubt it will be every day. I think we'll do probably several briefings next week. But again, it's important, we focus on things where we've got things to announce. The figures themselves are going to continue to rise, like I say, till at least the middle of next week. So people shouldn't have too much concern about that, because that will be natural, because we're still seeing cases that were seeded before the lockdown. But as and when we have things to announce, then we will come forward, and if necessary, convene press briefings at short notice.